Powerhouse Pulse Talk, a podcast where we explore various aspects of healthcare and dive deep into specific topics. I'm Sri, and I'm joined by my co-host Abra. Today we are spotlighting an important subject, supplement of migraine.
Hi, I'm Abrar. That's right, Sri. Migraines are a common yet often misunderstood conditions that affect millions of people worldwide. We are here to provide you with valuable insights. We are going to uncover the truths behind migraine, including the migraine types, pathophysiology, risk factor, signs and symptoms of migraine, to help you navigate the world of migraines.
We will also review the facts and fiction behind different treatment options, with supplement and self-care practice that can elevate migraine.
We are also going to delve into the impact of migraines on overall well-being, so we'll share some of our knowledge and stories, providing you with a holistic perspective.
So, whether you are someone who experiences migraine or you are seeking to expand your knowledge on healthcare topics, Powerhouse Pulse Talk is here to be your go-to resource. Before we talk more about our topic, first, we need to know migraines are more than just headache. They are complex neurological conditions that can have a profound impact on individuals' life. But what exactly are migraines and how do they differ from regular headache? So let's find out.
That's right, Sri. Migraines are characterized by a severe throbbing headache, often on one side of the head. They come with many other symptoms that can vary from person to person.
Absolutely, Abra. People experiencing migraine may also be sensitive to light, sound, or even smell. They might even have visual disturbance or experience nausea and dizziness. Physical activity that is unilateral and exacerbated can also trigger migraines.
Eventually, the headache phase begins, which can last anywhere from 4 hours to 72 hours. This is when individuals often find it challenging to function due to the intensity of the pain and accompanying symptoms. We get questions from viewers. Is migraine one of the mental disorders? What's your opinion about this, Sri?
Some evidence show that migraine is related to mental disorders such as depression. However, their relationship is still unclear and it seems to have a bidirectional relationship where migraine will have an effect on the progression of depression and vice versa. So, there is a study supporting this opinion with the conclusion that anxiety has a stronger association with migraine and the physical symptoms of depression are more linked to migraine than emotional symptoms. This proves that somehow migraine is related to mental disorder on its own unique way.
Yes, it is important to explore the various types of migraine. The most common type of migraine is the migraine without aura. This migraine typically starts as a moderate to severe headache on one side of the head and can last from a few hours to several days.
Another type of migraine is migraine with aura. Aura refers to a range of neurological symptoms that usually occur before the onset of headache, such as visual disturbance, which is blind spot and flash of light, and tingling sensation on the face or difficulty speaking. Besides, a migraine also has a migraine aura without a headache. It is a silent migraine when an aura or other symptoms are present without a headache, and it happens in a small population. For people originating with migraine, when they get older, 40% of them will develop aura without migraine.
I think it is okay for us to talk about how the pathophysiology of migraine works. Don't worry too much because we are going to explain in a simplest form for the better understanding.
In addition, understanding the underlying pathophysiology can provide crucial insight into the mechanism driving these debilitating episodes. So I'm very sure it is important enough for us to know the pathophysiology of migraines.
Yup, that's right, Sri. Generally, the disturbances or activation of the central pain processing pathways causes primary headaches. The activation of the trigeminal-cervical complex begins with the activation of first-order trigeminal-vascular neurons. The activation is then projected to the brainstem from the trigeminal ganglion, activating the second-order trigeminal-vascular neurons. This follows by the activation of third-year trigeminal-vascular neurons in the thalamus.
Besides, the effect is related to the somatosensory cortex and the other cortical areas. The activation of the neuron causes the parasympathetic effect on the intracranial arteries through the release of neuropeptide, causing a vasodilation, hence trigger migraine. Serotonin released by the brainstem nuclei of the trigeminal vascular system also contribute to migraines.
After knowing all this information, the risk factors for developing migraine should be emphasized.
Yeah, sure. I could say that the population at high risk of having migraines is made up of people who consume food items like aged cheese, food additives such as nitrates, and our famous monosodium glutamate. The fact that a high intake of coffee or withdrawal from coffee can precipitate migraines. Sleep disturbance also such as lack of adequate sleep or too much sleep can also trigger a migraine. Don't forget that weather changes can sometimes trigger migraines. Moreover, many women can have migraine episodes during their menstrual period and be symptom-free otherwise. Not only that, but high stress level and anxiety most commonly trigger migraines.
Wow, Sri, that is a lot of information right there. Now that we have explored the underlying pathophysiology and risk factors of migraine, how about the signs and symptoms that individuals may experience during an episode?
Okay, great question, Abra. Migraine can present with a variety of symptoms and it's important to recognize that they can differ from person to person. So actually, migraine which affect children and teenagers as well as adults can progress through 4 stages: prodrome, aura attack and postdrome. Take note that not everyone who has migraine goes through all the stages.
Absolutely. 1 or 2 days before a migraine, you might notice subtle changes that warn of an upcoming migraine known as prodrome.
That's right. For some people, an aura might occur before or during migraines. Aura are reversible symptoms. They are usually visual but can also include other disturbance. Each symptom usually begins gradually, builds up over several minutes and can last up to 60 minutes.
Indeed, for the next stage, we have the attack stage. A migraine usually lasts from 4 to 72 hours if untreated. Migraines might occur rarely or strike several times a month. The last stage is postdrome. After a migraine attack, you might feel drained, confused and washed out for up to a day. Some people report feeling elated. The sudden head movement might bring on the pain again briefly.
Migraine can be challenging to manage, and while there are various treatment options available, some people turn to a supplement as a complementary approach to alleviate symptoms and reduce the frequency of migraine attacks.
Remember, supplements should be approached as part of comprehensive migraine management plan that may include lifestyle modification, medication and other treatments. It is crucial to have an open conversation with your healthcare provider to determine the best approach for your specific situation.
So, get ready to explore the world of supplement for migraine management. In fact, there are several supplements that have been studied for their potential benefits. One of the most widely recognized is Riboflavin, also known as vitamin B2. Riboflavin may help improve energy metabolism in brain cells by lessening oxidative stress and brain inflammation in migraines. It's often recommended to take Riboflavin consistently for a few months to see its potential benefits.
Yes, that's true. The American Headache Society explicitly recommend 400 mg of dose of vitamin B2 for at least 3 months to prevent migraine. It is notable that vitamin B2 is best absorbed when taken between meals. An analysis of 9 studies show that taking 400 mg per day of vitamin B2 for 3 months significantly decreased pain associated with migraine attacks as well as the duration and frequency of episodes. Another popular supplement is magnesium. It is a major mineral that's vital for maintaining nerve function, blood pressure and muscle function. The frequency of magnesium has been linked to mild and moderate headaches and migraines. Magnesium supplements may be particularly effective in treating premenstrual migraine headaches. Previous study has shown that migraineurs have lower serum magnesium levels than the normal population, and magnesium deficiency is strongly associated with migraine.
A review of 21 studies conclude that receiving intravenous magnesium can significantly alleviate acute migraine, while taking oral magnesium supplements helps prevent migraine attacks, significantly reducing frequency and intensity. Another study conducted in 2021 reveals that 63 people taking 500 mg of magnesium oxide daily for 8 weeks was about as effective at preventing migraine as the medication valproic sodium and did not have adverse side effects.
Based on the American Migraine Foundation, they recommend taking 400 to 600 of magnesium oxide supplement per day as a preventive option for migraine. However, consumer needs to keep in mind that magnesium supplements can cause diarrhea if overdosed.
So next, I will talk about Coenzyme Q10, which is another supplement that has shown promise in migraine management. So actually, Coenzyme Q10 is a vitamin-like compound that has antioxidant effects in the body. It may protect against the oxidative stress associated with migraine. Coenzyme Q10 may also reduce levels of enzyme that increase during migraine attacks and lead to nerve inflammation.
A study in 20 adults with migraine found that taking 200 mg of Coenzyme Q10 daily for 60 days led to significant reductions in the duration, frequency and pain of headaches people experience. An analysis of 6 studies also found that Coenzyme Q10 reduced the duration and frequency of migraine attacks. However, it did not reduce their severity. The guideline dose of Coenzyme Q10 is 90 to 200 mg daily for 60 days, but the typical dose that is recommended is 30 to 200 mg per day. It is well tolerated and for now, no report about this side effect on our bodies.
After that, vitamin D is one of the recommended supplements that people use to reduce their migraine. Vitamin D deficiency has been linked to migraine as taking vitamin D helps in preventing and treating migraine attacks. A 2021 analysis of 5 high-quality studies found that taking vitamin D supplements significantly decreased the duration, frequency and severity of migraine headache compared with taking a placebo. However, more research is needed to investigate the effectiveness, safety and dosage of vitamin D in migraine treatment. So the dosage recommended is 15 microgram of vitamin D daily for up to 70 and 30 microgram for age above 70. Other than that, the side effect will be shown when we take an overdose such as weight loss, heart arrhythmias, kidney stone, excessive urination, loss of appetite, fatigue and constipation.
I have one fact about an incredible hormone that plays a crucial role in our sleep-wake cycle, which is melatonin. The next supplement I will talk about is the melatonin supplement. What is melatonin? It is a hormone released by the pineal gland in your brain at night that helps a person fall asleep. But the low release of melatonin in our body also can cause headaches and migraine episodes. Taking melatonin may help prevent migraine attacks, possibly by protecting the brain from toxic molecules, regulating neurotransmitter and relieving pain.
Research on using melatonin in migraine prevention is still limited. So melatonin is generally considered safe, but more studies are needed to evaluate possible side effects and effectiveness. A study in 49 people with migraine or chronic headaches found that taking 4 mg of melatonin 30 minutes before bedtime for 6 months significantly decreased headache frequency.
Now, I will give an example of the supplements that you can find in the market, such as Remedy for Migraine by Blackmore, Beta Senses, Migraine and Butterbur with Feverfew. First, I will talk about Remedy for Migraine by Blackmore. It has been formulated using ingredients that may aid in reducing the frequency of migraine and assist in the management of migraine headache with regular use. The formula from Blackmore has been developed using ingredients that have centuries of use in Western herbal traditional medicine for treating headaches, along with B vitamins, which aid in the healthy function of the nervous system.
So, as I know, the vitamin B contained in this supplement are vitamin B6, B9 and B12, which are required by the body for normal homocysteine metabolism. So, when taken regularly, this remedy for migraine headache formula may assist in the management of migraine headache when they occur and may also aid in reducing the frequency at which such as migraine headache occur, potentially reducing nausea and vomiting associated with migraine as well as the headache themselves. This Blackmore's formula combine the traditional with the modern to try and lend a helping hand to migraine sufferers. But how about the drug administered, Abra?
As recommended, it needs to take 1 tablet per day, increasing to 2 tablets per day as required or as a professionally prescribed. But it is not recommended for pregnant women and persons with an allergy to diazepams. However, when a patient takes an overdose of this supplement, it also can cause nausea, vomiting and diarrhea.
Okay, thanks Abra. Next, I will talk about Vitaform Migraine. Actually, it is a comprehensive supplement with Riboflavin, magnesium, Coenzyme Q10, PA-free butterbur and proprietary blend for optimal cranial comfort, health and defense migraines. It is naturally sourced and free of aspirin, caffeine, gluten, soy, yeast, dairy, non-GMO rice or corn, and it can be taken in 1 capsule 3 times per day for 1 month and reduced to 1 capsule 2 times per day or as needed. So migraine actually is safe to use with most prescription medication. However, nausea, vomiting and diarrhea show as generalized symptoms of headache.
Additionally, certain herbal supplements like Butterbur and Feverfew have been traditionally used for migraine. Feverfew may help prevent migraines by stopping the production of prostaglandin and preventing blood platelets that will promote inflammation, inhibit serotonin receptor, stop vasodilation in the brain and stop smooth muscle spasm. Besides, it will spark healthy blood flow to the brain. In this way, Butterbur may help to maintain head comfort in healthy individuals. Now, Butterbur is also free of undesirable pyrrolidazine alkaloids, so it can be used regularly. Pyrrolidazine alkaloids are plant toxins associated with disease in human and animal. They can produce veno-occlusive disease of the liver with clinical features.
It also has GMP quality assurance. This one is NPA rated GMP certification, so that means that every aspect of the now manufacturing process has been examined and including their laboratory testing method. So the guideline for taking this supplement is to take 1 capsule 2 times a day for adults only, but not recommend for pregnant and nursing women and person with liver disease. The overdose side effect is the same as other supplements, so it's important to remember that supplement can have varying effect on different individuals and their effectiveness may vary, and it's always best to work with a healthcare provider to determine the right dosage to monitor for any potential interaction with other medications.
Remember, every individual's journey with migraines is unique. It may take time to find the right combination of strategies that work for you. Be patient, stay persistent and don't lose hope. We hope that today's episode has provided you with valuable insights and practical tips for managing migraines.
Thank you for tuning into Powerhouse Past Talk. I'm Suri.
And I'm Abra. Stay tuned for other episodes. Bye-bye.